The studies are in. The documentation is available.
Have you read the literature? Because it's there. It's published, it's printed, it's proven. It's no longer a question about it.
Here are just 3 of those studies. The British Medical Journal published a 10-year study which compared chiropractic care to medical care for low back problems. The study found that chiropractic treatment was significantly more effective than medical care. Results from chiropractic care were long-term, and that Great Britain would save millions of pounds annually if hospital low back patients were instead seen by doctors of chiropractic. Now let's look at a major Canadian report. The Ontario Ministry of Health financed an independent study on low back pain treatment. After reviewing scientific studies from around the world, the 1993 report concluded that chiropractic care is more effective, safer, and less costly than medical care. Injured workers returned to work much sooner when treated by doctors of chiropractic, and that there would be a highly significant cost savings if low back pain cases were transferred to doctors of chiropractic. Now listen to what the Canadian report recommended. Chiropractic should be fully insured and fully integrated into the healthcare system. Chiropractic services should be encouraged and preferred for most patients with low back pain. And hospitals should extend privileges and employ doctors of chiropractic. The third study comes directly from the United States government. In December 1994, an agency of the United States Department of Health and Human Services took a firm position on what treatments work and what treatments don't work for acute low back pain in adults. The guidelines were produced after evaluating over 10,000 medical abstracts and studying nearly 4,000 scientific articles. The distinguished panel was composed of 2 representatives each from nursing, physical therapy, osteopathy, chiropractic, an occupational therapist, a consumer, 2 PhDs, and 11 medical doctors. Other than acetaminophen and non-steroidal anti-inflammatory drugs like aspirin, what treatment did the panel recommend for low back problems? That's right, spinal manipulation, the exact type of treatment that doctors of chiropractic have been performing for 100 years. And finally, what was the only recommended treatment that could relieve symptoms, increase function, and hasten recovery? Right again, spinal manipulation or chiropractic adjustments. Of all healthcare professionals, doctors of chiropractic have the most extensive education in the field of spinal manipulation. A recent survey showed that doctors of chiropractic receive an average of 563 hours of training in manipulation, compared to 146 hours for osteopathic doctors, 0 hours for medical doctors, and 0 hours for physical therapists. It's no wonder that the chiropractic profession is acknowledged as the leader in this recommended form of treatment. That fact was even confirmed by the prestigious RAND Corporation, which reported that 94% of all spinal manipulation is performed by doctors of chiropractic.